Okay, dear students, let us continue from page number 26 of your SPL book. And we look at the subtopic healthcare and equality. Okay, so far we've discussed about the healthcare services in India, and we've also compared and contrasted public and private healthcare services. Okay, now we will look at healthcare and equality, and we would like to find out whether it is adequate to all, whether the healthcare facility is adequate or enough for everybody. Is it available to all is the question. So what do you think? Is it available to everybody? Is it adequate, the healthcare facility in India? Is it adequate or enough for everyone? Okay, let us find out. Now, here we see that we already discussed that in India, the number of hospitals that has been growing is not the public hospitals or not the government hospitals, but they are the private hospitals. Okay, so we find out that it's the private hospitals or private services that has been increasing and not the public services or the government hospitals. Okay, and because of this, there is a problem now. Okay, number one problem is that all these hospitals, majority of these private hospitals are concentrated in the urban areas. Okay, they are found in the urban areas, in cities and larger towns. Okay, and what happens, another greatest disadvantage is that the private hospitals are expensive. Okay, all the services that they provide cost a lot of money. Okay, the cost is high. Okay, for example, doctors' fees, hospital bed, room, facilities, medicines, everything, every treatment or every test, laboratory test that we do, त्यो सबै नै एकदमै महँगो भएर जान्छ. Okay, and because of this, even people who are not, whom we would not consider as poor people, if there is any kind of sickness, यदि कोही बिमार छ उनीहरूको परिवारमा भने even those not so poor people will have a very hard time. एकदमै साह्रो पर्छ to bear the expenses. Okay, त्यो hospitalको बिमारीको खर्च उठाउन एकदमै साह्रो पर्छ, and many people also need to borrow money, okay, just to get themselves treated in a private hospital. Okay, and another disadvantage of the private services are that private भन्ने you have to understand that private sectors, they are one of the most important motto, right, is profit. Okay, whenever they start a business or anything for that matter, whether it's a school, whether it is hospitals, whether it is a shop or any business. Okay, private, the moment it is private, there will be profit in mind. Okay, फाइदा हुनुपर्छ, यो गरेर चाहिँ मैले यो हस्पिटल खोलेर यो स्कुल खोलेर मैले फाइदा ल्याउनुपर्छ. That profit thought or mentality is always there. जसले गर्दा चाहिँ sometimes it is said that private services ले एकदमै incorrect practicesहरू गर्ने गर्छ अरे. That means उनीहरूले cunningly कामहरू पनि गर्छ. For example, it is said that sometimes the doctors will prescribe medicines, एकदमै नचाहिँदो medicine. Okay, maybe you could have been given one tablet and then you would have been all right, हैन? तर त्यस्तो नगरेर instead they prescribe superfluous medicines. That means चाहिँदा, you don't need it, it's not needed. Okay, चाको भन्दा बेसी तपाईहरुलाई दिन्छ है. And any medication whatever they give, they are एकदमै बेसी दिन्छ, महँगो खालको दिन्छ दबाई, अनि त्यसले गर्दा चाहिँ the cost is even higher. Okay, and statistics, if you look at the statistics, it is said that in fact barely 20% of the population, India ma barely there are 20% people who can actually afford the treatment in private hospitals without feeling the pinch of losing money. So it is like that. So that means even the people whom we just the people whom we do not consider as poor, uh, you know people whom one might not think as being poor, even they have a very hard time meeting the medical expenses. हस्पिटल ट्रिटमेन्टको खर्चहरू उठाउन एकदमै साह्रो पर्छ, कठिनाइ हुन्छ, हार्डशिप भनेर यहाँ भन्नुभएको छ. ओके, and many a times people either have to borrow money, take loan, or उनीहरूको कुनै property छ भने त्यसलाई बेच्नु पर्छ. So private sectors, yes, there are lots of hospitals, good hospitals, great hospitals, but very expensive. Okay, and people who are not so poor, if they are having such a problem, people who are really poor, the उनीहरूको condition is even more dukha lagdo, isn't it? They'll have great anxiety and distress. All right, and now see, whenever people fall ill, it's mainly due to not only it's again there are lots of factors जसले गर्दा तपाई बिमार हुन सक्छ. For example, if we live in a very dirty environment, है, वरिपरि मैला छ भने the chances are high that हामी बिमार छिटो हुन सक्छौं, है. If हाम्रोमा खाने पानी सफा छैन भने chances are high that हामी फेरि पनि we can fall sick. Okay, so यस्तो पाराले, so हाम्रो बस्ने whatever basic amenities, if you don't have the basic things that we need, if you don't have that or proper त्यो छैन, सफा छैन भने we tend to fall sick. So imagine a poor people, already they don't have much money. On top of that, they live in all these conditions where they don't have clean drinking water. There is no proper sanitation, toilet को facility राम्रो हुँदैन, घर राम्रो हुँदैन, slum area मा बस्छ, and त्यसै पनि they tend to fall more sick भन्ने कुरा छ. Okay, and already they fall more sick, they don't have money, and the hospitals, government hospitals are very few, and private hospitals are very expensive. So it is a condition. So again, the topic coming back to healthcare and equality. So do we see equality here? No, there is no equality. First of all, public or private hunale garda, and private being super expensive and public being not enough, what happens is already equality छैन. And equality, again, keeping in mind, हामीले chapter 1 मा पनि हेरेको छ, democracy को one of the key feature नै equality हो. But we see that the government of India is not able to give equal treatment or equal facility to everybody. So यहाँनिर हाम्रो धेरै हाम्रो के भन्छ constitutional rights हरु violate भइरहेको हामीले यहाँनिर देख्न सक्छौं. Okay, and again, poor and rich, because of money, because of more money or lack of money, त्यसले गर्दा पनि एउटा even to get a treatment or a medical treatment पाउनुमा पनि त्यहाँनिर problem भइहाल्छ. Okay, and then we look at okay, lack of money त भइहाल्यो एउटा, that is an equal कुरा त्यसमा आएन. But in India, another example is women. Okay, women's health, यसमा पनि हाम्रो inequality हामीले देख्छौं. Why? Because mainly, I'm sure you all must have noticed at your own homes also, है, तपाईहरुको आमाहरुले, बोजूहरुले, है, दिदीहरुले गर्नुहुन्छ होला, है. So what happens is, women, we tend to consider our health less important, है. यदि for example म आमा हो, if I'm sick, I would say rather, okay, I think I can handle it, I can manage it भन्दै हामी चलिरहेको हुन्छौं. But यदि कोही नानी या फिर हस्बैंड बिमार भयो भने हामी automatically अपि हस्पिटल जानुपर्छ, चेकअप गराउनुपर्छ भनेर we make rush. तर आफ्नै हेल्थको लागि चाहिँ हामीले त्यसलाई प्रायोरिटाइज गर्दैन, त्यसलाई इम्पोर्टेन्ट मान्दैनौं. And because of this, women health मा पनि को treatment मा पनि inequality भइरहेको हुन्छ. In the same way, in tribal areas, अब त्यहाँ त the condition is even worse, because they live in such remote places, and there is no, forget about money or lack of money or anything, but they don't have only any facilities जहाँनिर they can go and get themselves treated. Okay, so through all of this we find that healthcare मा equality छैन. Okay, and again adequate cha भन्दाखेरि पनि adequate छैन. Yes, we may have lots of hospitals, but they are mostly private hospitals, and mainly looking at the poorer and the disadvantaged group of people, we find out that no healthcare services are not available or adequate to for all. Okay, so what can be done? Okay, so what can be done? We'll just look at two examples that has been given in your next page. But what we've understood so far is, health situation in India is not good. Okay, health situation in India is not good. Now, another thing is, it is the responsibility of the government to provide quality health care services to all its citizens and mainly to the poor and the disadvantaged. This we have read this in the book. It's the responsibility of the government. It's the responsibility of the government. Okay, all right. So this is clear, I hope. Okay, but again, when we talk about health, health बिमार नहुनुलाई मात्रै हैन, but like I said again, factors, there are many factors related to health. है अनि के कारणले गर्दा मान्छे बिमार हुन्छ, all that. So यहाँनिर एउटा बेसिक एम्युनिटिज, सोशल कन्डिसन्सको कुरा आइहाल्छ. ओके, सो हामीलाई हेल्थ केयर, हामीले सिटिजनको हेल्थ इम्प्रुभ गर्नु छ भने just because just by building many hospitals matrai, that's not enough. Okay, hospital थुप्रो छ र बिमारी हुँदैन भन्ने हैन. But instead we need to focus on providing basic amenities to all, like proper water facility, clean drinking water, sanitation, hygiene, यो सबै कुराहरुलाई चाहिँ प्रोवाइड गरेको हुनुपर्छ. Okay, so this is what we are trying to look at. So what can be done भन्दाखेरि चाहिँ we can learn from two places. One is in Kerala in India. Okay, so यहाँनिर Kerala experience भनेर भनेको छ. Okay, and Kerala is right here, this small state over here at the end bottom of the Indian map is Kerala. And then we'll look at another country in South America, which is Costa Rica. Okay, उनीहरूले के गरेछ भनेर त्यहाँबाट we'll try to learn. So Kerala मा interesting भएको छ. So जब every state gets their own budget from the center. So Kerala ले चाहिँ in the year 1996 what they decided to do is they something very के भन्छ एकदमै different है, कहिले नसोचेको. So what happened is the government decided that 40% of the entire state budget, okay, so 100 मा 40% चाहिँ उनीहरूले they are going to give it to their panchayats भनेर भन्यो. अब पञ्चायत कहाँनिर हुन्छ? In our rural areas, हैन, in the villages, है, गाउँ बस्तीमा पञ्चायतहरु हुन्छ. So त्यसले गर्दा that means 40% of the fund is being moved to the rural areas, remote areas जहाँ पञ्चायतले कामहरु गर्नुहुन्छ. And with this money, what are the panchayat going to do? Whatever they have requirement of, त्यसलाई उनीहरूले पूरा गर्नेछ. So for example, they will proper planning गर्नेछ है. And for example, water, food, women's development, education, यो सबै एरियालाई उनीहरूले राम्रो बनाउनु हुनेछ. Okay, proper बनाउनु हुनेछ. So with that 40% of the budget, state budget, okay. And apart from that, उनीहरूले check पनि गरेछ. So water supply को schemes they were checked. अनि त्यहाँदेखि schools proper functioning कस्तो छ, school को quality and everything. आंगनवाडीज हरु एकदमै important हो remote area मा. Okay, यो सबै कुरालाई उनीहरूले राम्रो बनाउँदै जानुभयो. Okay, so that way even health center were improved. Health center जुन primary health centers हरु त्यो पनि एकदमै improve भयो है. डेभलपमेन्ट ल्यायो त्यहाँनिर पनि है. चाहिने कुराहरु whatever was required त्योहरुलाई हाल्नु थाल्यो. Okay, but again what we see is that सबै हुँदा हुँदा पनि a lot of times the problem was infrastructure त बनायो, सबै ठीक गर्यो, तर sometime for example shortage of medicine भयो, hospital bed पुरा भएन है, या फिर डाक्टरै थिएन. So यसो हुँदाखेरि चाहिँ कतिवटा प्रब्लम रह्यो. But even then with that 40% of budget being moved to rural area, गाउँ बस्तीमा त्यो 40% पैसा, त्यो उनीहरुको बजेटको 40% जान्दा चाहिँ it made a lot of difference, lot of improvement were brought in the rural areas of Kerala. So this is something that our state and any state in India can also follow, okay, and learn from them. In the same way, अब अर्को इन्ट्रेस्टिङ अर्को स्टोरी छ कोस्टारिकाको. कोस्टारिका इज इन साउथ अमेरिका, अलिक भनिहालेँ. सो साउथ अमेरिका कहाँनिर, इफ यु निड टु जस्ट चेक इट भन्यो भने चाहिँ आई वुड एन्करेज यु अल टु गुगल एन्ड फाइन्ड आउट चेक अन एटलसमा हेरेर भए पनि. सो नर्थ अमेरिका एन्ड साउथ अमेरिकामै अलिकति यता जोइनिङ उयो यस्तोमा जस्तो छ. सो यहाँ समवेयर ओभर हियर यु विल फाइन्ड दिस कोस्टारिका. ओके, अब कोस्टारिकाको अर्को इन्ट्रेस्टिङ कुरा चाहिँ के भएछ भने they did something very different. Okay, so what they did is they made a decision to not have an army. अब हेर्नुस् है, every country, most majority of the country in the world, they have their own army or a defense को लागि एउटा budget अलग्गै हुन्छ. Defense is so important. For example, look at India. We have this huge defense, हैन, एयर फोर्स, नेभी भयो, आर्मी भयो, सबै उनीहरू एकदमै चलिरहेको हुन्छ. नयाँ वेपन्सको टेस्टहरू गरिरहेको हुन्छ, एभ्रिथिङ. एन्ड all of this costs money. But Costa Rica, a very small country in South America, they decided not to have an army. So why? के गर्यो त्यसो भए आर्मी नभएर? So instead, whatever money जुन चाहिँ आर्मीलाई जाने हुन्छ, त्यो money चाहिँ what they did, they spend it in a different way. And so where did they spend it भन्दाखेरि चाहिँ instead of spending the money on army, they spend it on the health of the people, education and other basic needs of the people. Okay, so they realized having an army is not so important for us, but what we need is healthy citizens, what we need is well educated citizens, and जसकोमा चाहिँ every basic needहरूलाई पुरा गरेको होस्. So this was their priority. अनि उनीहरूले आर्मीलाई completely हटायो, आर्मीलाई राखेन, and instead all that money otherwise जुन आर्मीकोमा जाने थियो त्यो चाहिँ उनीहरूले health, education मा चाहिँ and the basic needs of the people मा चाहिँ खर्च गर्नुभयो. Okay, and because of this, yes, Costa Rica is one of the most healthiest country in South America भनेर भनेको छ. Okay, and also, you know, उनीहरूले basic services and amenities मा पुरा ध्यान दियो. Like I said अघि नै, health is not only about having many hospitals, but it's about, you know, the government being able to provide, government ले के provide गर्नु सक्नु पर्यो, basic services, amenities है. घरमा राम्रो सबैको टोयलेट छ कि छैन, सफा पानी आउँछ कि आउँदैन, बत्तीहरू आउँछ कि आउँदैन है, सफा सबै घरहरू उनीहरूको सफा छ कि छैन, राम्रो छ कि छैन, कि पिपल आर स्टेइङ इन झोपडपट्टीमा बसिरहेको छ, दिज थिङ्स, यु नो. सो उनीहरूले सबैलाई त्यो कुराहरूलाई चाहिँ फोकसमा ल्याउनु भयो. ओके, एन्ड अगेन लाइक आई सेड, प्रोभाइडिङ अफ ड्रिङ्किङ वाटर, अल दिस थिङ्सहरू भयो. एन्ड उनीहरूको एकदमै इम्पोर्टेन्ट कुरा चाहिँ हेल्थ एडुकेसन. ओके, हेल्थ एडुकेसनलाई उनीहरूले एकदमै इम्पोर्टेन्ट मान्यो. And yes, that is यो धेरैचोटि people in India मा भनेको छ, in your book also it is mentioned that every year almost like 2 million, that means 20 lakh children die every year. 20 lakh children die in India. केले गर्दा भन्दाखेरि because of okay, because of improper you know drinking water छैन, के छैन. So people जो चाहिँ नमर्ने बिमारले मरिरहेको छ, फर इक्जाम्पल डायरिया, किड्स आर डाइङ अफ डायरिया. ओके, सो त्यस्तो पाराले भन्नु हुँदैछ. र हेल्थ एडुकेसन जुन एकदमै इम्पोर्टेन्ट हो, विच कोस्टारिकाको फोकस पोइन्ट हो एभ्री टाइम. ओके, सो दिस इज इट. थ्याङ्क यू.